All right, before we get started, let's start with some review. The complete destruction of all microorganisms on a surface can be achieved by A. Antisepsis, B. Disinfection, C. Sterilization, or D. Sanitation. Go ahead and pause the video. Think about this one. All right, the key here is all microorganisms. This would indicate sterilization, which is the killing of all microorganisms, even spores. All right, here's another one. You are tasked with sterilizing an injectable drug for use in human patients. Which method would you choose if the drug were heat sensitive? Would it be A, autoclaving, B, treatment with phenolics, C, filtration, or D, dilution in 90% ethanol? Go ahead and pause the video. Think about this one. All right, so I think you can probably rule these two out since we didn't talk about them. So that leaves A and C. The drug in this case is heat sensitive, so putting in the autoclave would probably destroy it. So that leaves filtration, which is a common problem that we have. So we have little syringe filters that you can filter sterilized drugs with. All right, in chapter 13.3, we're going to talk about chemical agents of disinfection. We're going to talk about the factors that can influence how well disinfectants can work, talk about how disinfectants are judged and compared and measured, list some basic commercial disinfectants and their uses, and then talk about the emergence of microbial resistance to disinfectants, which is a problem. So the big issue, how useful a chemical agent is, depends on several factors. As we talked about, the presence of organic material, which the agent might bind to, lowering its ability to kill other bacteria. The type of microbe that's present. Ideally, your chemical agent will have a broad range of activity on all microbes, but that's not always the case. One factor is corrosiveness. It can't degrade or corrode metals. That would be a negative factor because that might introduce rust, things like that. The metal might be weakened. And it can't be corrosive and damage skin. If the skin is being removed by the cleaning agent, that is a definite downside there. It also needs to be stable, so it needs to last for a long time. It's no good having a cleaning agent that can only last a few days because then it would go bad on the shelf, and that is negative for many reasons. One, people aren't going to buy it. Two, people might keep it and it might go bad. So they think they're cleaning, but they're actually not because the chemical is no longer effective. That is probably an even worse scenario where you think you're cleaning, but you're actually not. The odor can't be too offensive, otherwise people won't use it or it might make them feel ill. And then the surface tension is a factor. Surface tension is the ability of liquids to form beads, I guess. So you think about water on a freshly waxed car or something like that. You can see the surface tension in the little droplets. Lower surface tension means liquids are able to penetrate into small cracks and crevices. So low surface tension is important because if we have porous materials or things like that, we want the cleaner to be able to penetrate into that. The CDC has different levels of disinfectants based on what they kill. The highest level will kill vegetative bacterial cells. That's the normal growing ones. Mycobacteria, spores, fungi, and viruses. These are often very toxic chemicals, though. Things like ethylene oxide, glutaraldehyde, formaldehyde. These will kill things, but they are rather toxic, so they're not used in all cases. Intermediate levels, you can see they're killing everything except spores in this case. Phenolics, halogens. And then for general disinfection, We have the low grade. This is not killing mycobacterium and spores and may or may not destroy viruses. It depends. We have things like alcohols, which are relatively not very harsh, so we use them in ammonia compounds, things like bleach and stuff like that. These are probably the most likely to be used in the home. These are more probably industrial, where spores are not available. So these different levels have different chemicals that do them, and they are tested. How they are tested is with a process called the use dilution test. It determines how well a disinfectant kills microorganisms that are dried onto a surface. So there are two surfaces that are tested. We have non-porous stainless steel. You can see these little kind of cylinders here are stainless steel. And there's also porous tile. So here is a tile cylinder. So microbes are applied to them, let to dry, and then the disinfectant is added. And then these tiles or cylinders are placed in a liquid medium to see if there's any growth that occurs. And this can be tested for various different microbes. So this is the use dilution test, and it comes up with our standardized rating. And then the CDC can recommend different institutions to use different cleaners. Commercially, the things you're most likely to run into are types of alcohols, ethanol, iodine, chlorine-based compounds. These all disrupt various parts of the cell, particularly membranes and DNA. They might break down proteins as well. The more different parts of a cell that a chemical attacks, the less likely a bacteria or whatever can evolve resistance to it. So if it attacks multiple parts like the cell membrane and cell proteins, if it attacks that and the DNA, it's very unlikely a bacteria would evolve resistance to all of those things. There are even some things like metals such as copper that have antimicrobial properties. Also, silver is another one. Based on their molecular structure, they can kind of disrupt the membranes of bacteria. So there are some thoughts to use these metals for high-touch surfaces. Of course, they're very expensive metals, so that is not widespread, but in places like hospitals and things like that, there are thoughts to use these metals for high-touch surfaces to help with antimicrobial properties. Okay, that's it for 13.4. We'll talk in the next one about antimicrobial therapies for infections.